Endothelial keratoplasty. An endothelial corneal transplant, such as a Dsaek, involves the preparation of donor transplant tissue. Here, tissue that has been pre-cut to the correct depth is prepared by orientation marks and then cut to the desired width, ready for transplantation. The patient's eye is prepared with a tunneled incision of around 4 to 5 mm at the side of the cornea. An infusion device is inserted to maintain the shape of the eye during surgery. The defective cells lining the back of the cornea, called the endothelium, are stripped away and removed from the eye. This is usually achieved with visualization under air. Small venting incisions are made to help make the transplant adhere, and the main incision site is enlarged. The prepared endothelial transplant is mounted into a device called the endoglide. The graft material is placed with the endothelial cells facing upwards on the endoglide base and pulled into the cartridge with specialized forceps. The endoglide is inverted, ready for insertion, and the flat blade of the device placed in the incision and advanced until a seal is formed. Forceps are used to gently grab the graft material from the opposite small incision and pulled into the front chamber of the eye. The endoglide device is removed and a small air bubble is then injected underneath the graft before the incision is sutured. The graft is then centered and a larger bubble is injected into the eye to allow it to attach the graft to the back surface of the patient's cornea. The air bubble will be partially released for the air bubble to help attach the graft fully to the patient's eye, and the patient will usually be asked to lie flat on their back for an hour or so after the operation. This procedure may be combined with cataract surgery or completed as a separate operation later. The sutures are removed at a later date.